Let's discover the secrets of best hair transplant today. Also, if you want to undergo a hair transplant and you want to know how you would look after your hair transplant, I have great news for you in the middle of the video. So stay tuned. Our today's patient had receding hairline. Both his temples were bald and there was thinning in the mid-frontal and mid-scalp part region of his scalp. His father also suffers from baldness. So likewise, here what happened that he started losing hair for last 4 to 5 years. So in a gradual manner, he lost his temple hair, thinned out the rest of the hair. Also, he tried a lot of medical treatments for that. If we talk about the grade, then the grade was around grade 3 Norwood Hamilton. So please hit the like button now so that many more people like you are benefited by it. And then we'll move to the next section, which is very important and is called trichoscopic analysis. Trichoscopic analysis means computerized assessment of scalp and hairs. When we did this for him, we could make out the density at the donor site was about 80 grafts per centimeter square. The area at the donor site was around 135 centimeter square. The average diameter of hair was around 0.07 millimeters, which when calculated how many grafts we can take out, so we could easily take out 4,300 grafts from the donor site without thinning of the donor site. The coverage value was around 12.32. When we did calculations for the recipient area, we could find out that the recipient area was around 79 centimeters square. If we give a density of 35 grafts per centimeter square, we needed somewhere around 2,700 or 2,800 grafts. Since the number of hair per follicular unit was around 2.2, so this made the total number of hairs which were given to him more than 6,000. If you have any comment or you want to ask anything about trichoscopy or how we calculated the donor area and the amount of number of grafts required, you can ask in the comment section below. Also, you can WhatsApp us or you can call us on the numbers below for consultation for your hair transplant. On the day of the procedure, he arrived after having a good breakfast. When he came, then we made a good hairline for him, which was according to the shape of his face, and the frontotemporal angles were acute and the mid-frontal point was around 7 centimeters from the glabella. The mid-frontal point was already there, so we just had to strengthen the mid-frontal point. We then tested him for any allergies with the antibiotic we were to use during the day or the local anesthesia which we had to use. Next, we took him for surgery. When we started doing the hair transplant, we gave the ring block local anesthesia first. Then we made the slits so that we know where and how to place the grafts. Next, we took out or harvested the grafts from the donor site. We then put the grafts inside the pre-made slits. The procedure was finished. We did the dressing for him, gave him a bag of 5 days medicines, including the antibiotics, told him how to take care, how to take the post-op care, how to wet his hairs, and a number of other post-op instructions, and then he went home. We also gave a number of 2 or 3 of our OT staff so that if he feels there is any problem, they are always there to help him out. Do subscribe to this channel so that you get more of such educational and testimonial videos to see. Now you can see the results when he came for PRPs and to review at 3 months, 4 months, 5 months, and then 7 months. Gradually you can see the hair are coming out in the part where he was bald before, and the results at 7 months are very promising. Patient is very happy. He has a very good hairline now and he can comb his hair as per his own wish. The angle and direction of hair coming out is very natural, and he says that nobody is able to make out that he has undergone a hair transplant. Coming to the app now, which will help you understand how you will look after your hair transplant. Welcome to the Saraswat Hospital Peak AI app, where you can know your result post hair transplant just in 3 quick steps. You download the app, take the quiz, and then you upload your pictures in the app. You will be sent the results in 24 to 48 hours after they are reviewed by the ABHRS certified hair transplant surgeons. You'll get to know what all questions you can ask your doctor when you are up for a consultation, and also around approximately how many grafts would be required by you for a good hair transplant result. I'm sure you're happy with the wonderful result this patient is getting just after 7 months. The density would increase up till 12 months at least. So the take-home message of today's video should be hair transplant planning should be a long-term planning backed by a good trichoscopy so that you have a clear view as how your donor site is and what will be the effects of donor site hairs on the recipient area. You should know the certifications of the doctor which is going to do a hair transplant for you. So they should be at least American board certified, members of good national and international organizations like ISHRS, and also they should have a proper team, experienced team. The doctors should be experienced, and there should be abundant testimonials for you to see online and offline so that you know that you are going to be in safe hands and in safe clinic. Do share this video with your friends and family who are planning for a hair transplant. If you want to know about cost of hair transplant, please click the video on the left, and to watch our latest hair transplant testimonial video, please click the video on the right.